Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
And our opinion is sometimes right.
Well, Bob, we're getting better all the time.
All right. Today we're going to talk about top 3 ways to stop inside joint knee pain and how to tell if you're having inside knee joint pain.
Right, because you always kind of wonder, is it in the joint, is it arthritis, or is it a ligament, or is it the muscle?
Is it the meniscus inside?
Sure.
And it's a big difference over your outcome a lot of times, and so we're going to talk about that. By the way, if you are new to us, please subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. And we've got some big news, Brad.
Oh, yes.
This is big news. If you got to go to Facebook and like us now, because it's Bob and Brad on Facebook, because we are giving away a mattress. What?
Yeah, and not a cheap mattress.
This is
top of the line.
Top line Sleep Ovation mattress. You're going to want to go. All you got to do is, it's going to be the first post on our Facebook page.
Okay.
And you just have to like it and comment on it. You're in the contest.
Right. And the comment doesn't have to be a long narrative. It can be just
and be nice. Be nice.
Yeah.
Don't say something nasty to us.
Say you like Bob and Brad.
Yeah. Say you like Bob. Okay. So the first thing you're going to want to do is you're going to want, this I'm talking about, you're humming along in life, and all of a sudden you start getting some knee pain.
Right.
There was really no injury. It just started hurting. So I'm talking about non-injuries. That's,
Yeah, without falling on it, without obvious twisting, you just get up and it's like, oh, it starts to hurt, and it's gradually getting worse day by day or week to week.
As you start getting to our age, that kind of crap starts to happen. You just wake up one day and your knee starts hurting.
Yeah, it's a lot, yeah. Anyways, carry on.
So to me, the first thing, when my knee starts hurting, I'm like, oh gosh, is it inside the knee or is it outside the knee? Because if it's outside the knee joint, it's a lot easier to treat generally.
Right.
But if it's inside the knee, so we got a knee here. I don't know how close I can go to you, Liz. What's the restraining order say now?
Yeah.
So I don't know if you can see. This is the quadricep. This would be about right like this. I probably just lost you, didn't I?
This is like one of those little models of knee joints they have at the doctor's office.
How are we doing? Okay. So I'm going to open up the knee. And Brad's going to show us where the meniscus are.
Well, by the way, this is a kneecap with the
patellar tendon.
Right, with the tendon over the top. So we're just going to disconnect that so we can look inside, get the kneecap out of the way. And in here, we've got the cartilage that's right on the joint itself. And then there's the meniscus is like a cartilage.
Yeah, they're like horseshoe shaped.
Right, right. If we could tear it apart and you could look at it from the top down, you could see.
Yeah, they provide like a cushioning. And as you get older, little pieces of that can actually break off.
Yeah.
And what's interesting has happened over this past couple months. It happened to my wife. It happened to our office manager at one of our offices.
Sure.
And it happened to a nurse I know. And it's all been kind of interesting, the different outcomes that they've had.
These are all people you know, by the way, Bob.
I know. So I'm waiting for my moment.
You could be next.
Yeah, I could be next. Well, they happen in threes. So.
Three. Then you're fine. You're clear.
So the first thing you want to know, is it inside the knee? And we're going to show you a couple tests that you can do to try this. And so one of them is the Thessley, or for you lay people, we'll call it the disco test.
Sure.
Do people even know what disco is anymore?
No,
young people?
Yeah, if you're over 50, you do.
Yeah.
If you're, around.
All right, so you're going to hang on to the back of a chair. You're going to bend your knee just a slight, about 5 degrees.
Right.
And you're going to twist, just like this. And I'm testing this knee. And you're looking for pain.
Right. And I've been using this quite a bit in the last year with patients. And what I'll do is I'll do it, and if they have pain, it doesn't say yes, the meniscus is bad.
No, it doesn't say yes, but it's a possibility.
Right. And then we'll do exercises for a couple weeks, and then we'll retest it and see if the pain is better or worse.
Good approach, Brad. Okay, and the other one you can do, the same thing, you're going to bend it to 20 degrees, and now you're going to twist.
Right.
So now you're getting a little more into the joint, and there's more possibilities there of hurting. And then, Brad, you want to show the duck walk?
Yes. I just had someone with this earlier in the spring, and she had knee pain, and I was trying to figure out what made it worse. And she did this one, and as soon as she started, it hurt. It was very clear.
Again, it's not necessarily saying that it is meniscus, but it's starting to say, yes, it's something in the joint, likely.
Well, we did some of the exercises we're going to show, and within 2 weeks,
it was better. She could do it. Yeah.
Yeah, life got better for her, and it was a good deal.
The other thing you want to do is you can go ahead and we'll show on a real knee, Brad, because actually this is, I hope I can get my pant leg up. I can.
Oh, that's a beautiful sight, Bob. Look at that leg. Wow.
There we go.
Gargoyle socks and everything.
Argyle stock.
Oh, yeah, that's right.
All right, so you have your kneecap here. So the joint line is if you put your hand right underneath the kneecap like this, kind of make a smile underneath the kneecap.
Sure.
That's right where the joint is.
Sure.
So if you push along on there and it hurts on the joint, but it doesn't hurt anywhere else, well, that means there might be something going on in the joint.
Right. The joint. You know, I went to an orthopedic knee surgeon because I had some knee problems. This is about 15 years ago. And that was his primary assessment. It was a big one for him.
Yeah, and I remember when I followed an orthopedic surgeon, same thing. He goes, well, it hurts up here and here, so that's ligament. If it hurts right along here, it's joint.
Sure, yep.
So, all right, so let's say we've determined that it may be inside your knee. These things that we're going to show you are actually good for your knee, probably no matter what you're doing. But so the first thing you're going to do, you want to get the knee to calm down. So you're going to grab an ice pack.
Behind you, Bob, on the left.
Thank you. So they got a lot of different ice packs you can use. You can take a bag of frozen corn if you want to.
Or peas.
Or peas.
Depends on what you want to eat next.
Yeah.
But
I suppose you can eat them. They're in a bag after.
well, yeah. Well, if you melt, whatever. We'll go on. But yeah, you can. We've got a really good video if you want to make your own frozen.
Oh yeah, well, you make your ice pack.
Yeah, Bob and Brad cold pack.
Yeah.
How to make your own FYI. I think it's labeled.
Yeah, we got a couple of them on there.
Yep.
So
we should maybe do another one just for the fun of it.
maybe should.
Come at it from a different angle. But this is a nice cold pack you can purchase.
So just put it on for like 20 minutes. You can do it a couple times a day to help calm things down. You can take, an anti-inflammatory. And a lot of times the doctors will even allow you to bump it up a little bit and take a higher dosage for a short period of time.
Yep, some ibuprofen.
We did that with my wife. We bumped it up for a little while.
How much was she taking?
She was taking 600 milligrams 3 times a day.
Okay.
So, and when she saw, we did have her go in and do x-rays. And they told her she could do that for a while, but that was her. I don't want to say it, as general to everybody because people have medical issues. And
right, yeah, there's some side effects possibly with that.
All right, the next thing is, and this is key, and this is one of them that most of you are not going to want to do. My wife didn't want to do it. My office manager didn't want to do it. The nurse was the only one that she was willing to. She's like, yeah.
She did?
Yeah.
What are you talking about, Bob?
Decreasing the weight on the knee. And that's one of the things that's going to really help decrease the pain. So one thing, just avoid stairs, avoid hills.
Right.
But then you're going to want to get some type of gait aid. You want to grab
let me help you, Bob.
Yeah.
We'll start out with this.
So people are going to go, are you kidding me? I'm not going to use a cane. Are you joking?
Right. Especially if you're, below 70.
Yeah, right. And sometimes even if you're below, above 70.
Yeah,
people are
I've
going,
had that as well.
use a cane. Pride comes before the fall. Remember that one, Brad?
Yeah.
So anyway, my wife says like, no way am I going to use a cane. And then it got so bad, she used a cane. The husband's always right, Brad?
Yeah, we could say that now.
We can say that now, and there's no close wives close.
Right, yeah.
All right, so this is actually, she actually used one similar to this because her hands got so sore, we actually bought, you can buy this extra padding to put on top.
Yeah. You can take I've used this like a
washcloth.
Small, taller washcloth. So anything for padding on there and tape it on.
Lamb's wool.
Oh, yes.
So,
if you got a
but
lamb.
to be honest with you, the crutch really didn't, this didn't do it, so we went to a crutch. She felt more, that felt more like an athlete, but of course, she had to put up with everybody's asking, what happened? What happened? And she had to say, nothing happened. It just started hurting.
Yeah, I got a sore knee.
So she went to the single crutch. Same thing. We got some extra padding for it that you can get on like the internet. Padding for crutches because it really got sore. And she just needed one side, and she could go along. And then when we went on a trip, actually, and it was starting to get better, we got her a walking stick.
Something like this.
Something like this. Right. That she could. It was actually even a little bit smaller, so she could walk with it without being self-conscious about it.
Sure, yeah. The key with any of these, if your left knee is a painful one, you use the device on the opposite side.
Right. It generally gives you more normal gait pattern or walking pattern.
Right.
So you're going like this instead of going like Dr. House.
Yeah, on that show. Yeah.
On that show, Dr.
I wonder
House.
if he's still around.
Yeah, I don't know if he's still around.
But anyways, we got some good videos specifically for how to use those.
All right, next year what you're going to do is this is kind of key, you're going to want to make sure you've got full motion in your knee. By full motion, I mean, so let's say this is the involved knee.
Sure.
You got full flexion.
So it's going to bend all the way, just like the other knee?
It's going to straighten all the way.
Right.
And you do it by comparing it to the other side. Now, with my wife, she did not have full flexion. I mean, she can feel too. It feels tight compared to this one.
Right.
So we started having her stretch, and one of them for flexion that you can do is you can just do this.
Yep.
You can go pressure on, pressure off.
Right.
Pressure on, pressure off. And you can do this throughout the day. You can do it every hour if you'd like.
Assuming this is not creating any sharp pain and irritating, making it worse after a few repetitions.
Oh, good point, Brad.
It should feel like a good stretch, and as you do more, it starts to loosen up and feel better. So keep that in mind. That's very important.
Yeah, don't make the pain worse. You can bump into the pain. You want to show how you can do it on the chair too, where you can just put your foot up and, well, I guess I can do the Mulligan technique.
Oh, yeah.
Why don't I do that?
Yeah.
All right, so this is a little more advanced technique. This is but what happens, and I'm theorizing here, Brad, I'm not sure about this or not, but it seemed to work with a lot of my patients. Like if a little piece of the cartilage has broken off,
Yep.
I think a lot of times by doing this, you can kind of shovel it into a spot that it doesn't bother you as much.
Sure, right.
So what you're going to do is you're going to put the foot up here without falling over, and I'm actually going to turn the lower bone towards the other knee. So in this case, I'm going counterclockwise with my right leg. So I'm turning the leg and I'm bending. And the whole time I'm bending, I'm turning the leg. I got a good turn on it.
So he's trying to, can you see this? So what he's trying to do is just put a little bit of a turn on the tibia, the bone below, and get some more motion with that. And again, this is one of those things you're only going to do it when you do it. It makes the knee feel better. You get more motion with it. If for some reason it creates sharp pain, then you can turn the other direction and see if that is better.
Sure. Generally, it is the turn, though. So if you're using the right leg, again, you're turning counterclockwise or towards the other knee. If you're using the left leg, you're turning it clockwise and towards the other knee. So I'm turning it and I'm bending it.
Right. That way typically works the best for most people.
So let's go into extension, Brad. With extension, what you're going to do is you're going to work on straightening the knee. So again, you can put pressure on, pressure off, pressure on, pressure off. And you can do it with the toe straight up, but you can also try it with the toe turned out to the side like this. And Brad's showing it on our knee glide, which actually works really good for this.
Right. Yeah, we've been selling these for about 1.5 years now, and they've been going very well. But they work well because they work good for the knee. That's why that's called the knee glide.
Yeah, right. So you can turn the foot out like this, and you can also turn the foot in and see which one feels the best. For my wife, it was turning the foot out like this.
Sure.
And she'd do pressure on, pressure off, pressure on, pressure off. We say the words because that's how long you should do it.
Gives you a cadence.
Yep, and it gives you about, again, we can do it every hour. I had her doing this, and I also had her doing it with the little stand up like this, Brad, just to get some motion in the knee. So she was just going, she was just doing gliding.
Yep.
Yeah, like this to get some motion in the knee, to get it to calm down, get it to lubricate, and work. So that's another thing that works really well with that. So. And
you can go to our favorite products under the video if you're interested in looking more at these.
Yeah. So, man, I don't know how we ended up taking so long today, but we did.
Well, Bob, we have a way of doing that. It's just a natural talent.
All right. Thanks for watching.